I didn't want to ask somebody that I had never met, never worked with. And to be really, really honest, I didn't ask anybody who I would trust with my own face. And so that's why I chose Joanna Christo from the Cosmetic Skin Clinic in London, because she has literally been in my face. Joanna works in the Cosmetic Skin Clinic. She has done my Botox on a number of occasions in the past, and I absolutely do trust her with my own face. Lots of these questions are about Botox, but inevitably we've veered into other areas of injectables because I think there's so much confusion over what does what. So I think quite often when people are talking about Botox, what they're really talking about is filler. And when they're talking about filler, what they're really talking about is Botox. So please, before we move on to the questions, can you just make a distinction that's really simple for people about what a classic person for Botox would be and a classic person for filler would be, or what you'd be trying to fix with each?
Okay, so the two things are both injectable treatments, but fillers are used to replace volume loss on the face. So where there is a change in contour through loss of fat pads with age, we would place a filler to create sort of structure and support. So it's something that is a completely natural molecule because we have hyaluronic acid in our body, and that's what a filler is. And you replenish this sort of structural support on the face to create that lift and that contour, which we see in youth. So that's a filler. Muscle relaxing agents, and there are lots of brands of this, are different entirely. They're actually a purified protein injected to stop muscle movement or control muscle movement. And it does this by blocking a nerve essentially that contracts the muscle in the same way that a dental anesthetic will block a nerve from feeling pain. So that's used where there are dynamic lines on the face associated with muscle contraction and movement. Common areas for that are often the upper part of the face, in the glabella, the forehead, around the eyes, but we could typically use it in the mentalis, in the chin, down the neck too, and there's lots of very clever things we can do with muscle relaxants.
So we should say that you are also an experienced dental surgeon as well, and so that's why your kind of perspective is quite a sort of rounded one. I think what lots of people have asked, as you say, Botox is a brand name. We're really talking about a kind of broad church of toxins that do kind of roughly the same thing in slightly different ways. Let's start with something that combines, I know, two of your passions, dentistry and injectable beauty treatments. So Ali Nightingale, lovely Ali Nightingale, she's one of my favorite followers. Botox for a gummy smile via dentist recommendation or a cosmetic practitioner. So tell us what she means by that, Botox for a gummy smile.
Yeah, so when people refer to a gummy smile, what they're referring to is a lip that elevates too much when you smile, and so the tooth to gum ratio is disproportionate or unfavorable. So a textbook perfect smile is when the lip elevates enough to see the crown of the teeth and just the first little bit of pink of gum, and no more than that. And that's what's considered the most aesthetic smile. Now, I do get a lot of requests for gummy smile treatment, and a lot of people do assume that relaxing the muscle, and it would be an injection here and here either side, is the most appropriate tool. But actually there are a lot of factors to consider, and sometimes structuring the lips with filler is in fact more appropriate. And sometimes it's dental work, so sometimes it's actually related to the position of the teeth, and that would therefore be the most appropriate route to go down. So the specific question from this follower of yours is an aesthetic practitioner or a dentist? Could be either. And it's a bit of a cop-out, I'm afraid, but it could be either. I think anything smile related, first maybe ask the dentist to check that the teeth are in a correct position, because if they're not, there could be some dental implication too. Are the teeth wearing out? Is there an overbite that's going to be a problem long term? And once that's been established and your dentist is happy with the tooth relationship, and it's simply to do with the soft tissue movement, then come to me and I'll assess the nerves, the muscles, the dynamic of the profile of the face, and I'll be able to recommend what is the best course of action from there.